Good rainy morning, everyone.
Good
Hope you could
morning.
all. Thanks for joining us this morning. We've got Tracy and we have Joanne.
Hey.
So welcome, welcome, welcome. This week I actually had Chrissy post on asking a question of what it is that you actually are looking for in a healthcare provider. There's actually a lot of literature out there, and it was kind of fun for me to go through the literature. And a lot of you people posted the same things that was in the literature about what people actually like. We're going to talk a little bit about that. But one of my favorite sayings, you know I love sayings, and I'm sorry I don't have the author of it. I couldn't find it because I was in a quick hurry, but tell me if feedback. I'd like for you people to tell me if this is true. People care that you know, but they more want to know that you care. I love that saying. So, Tracy, what did some people have to say?
All right, so from Christine, she said she likes being heard and feeling that she's not being judged when she comes in, which I like that one a lot.
Right, yep.
Shannon said when she's walking into the office, being greeted by her name, she really appreciates that. She liked that a lot. Tracy said speedy callbacks and same-day appointments, especially when you're not feeling well. Donna really likes that we take our time to listen, being truthful as a person, being treated as a person and not a patient.
Hey, wait a minute. You know what I just thought of with that one? You know, in school, we always use, or actually when I was first out of school and would be rounding in the hospital, we'd go to different patients' rooms and we'd say, okay, a 54-year-old diabetic. And I'm like, wait a minute, that's a 54-year-old female with diabetes. She's not a diabetic. You don't identify people with their disease state.
Labeled that way.
So
yeah.
that's a good one. That just made me think of that.
Jen said compassionate yet stern providers is what she really appreciates.
Ooh, stern. She might get that with Joanne, but maybe...
I was thinking Joan. With Joan.
I think Joan too, but
Ooh.
I'm being a little biased. And the last one that I really, really appreciated, I thought it was really funny, this is a funny one, is from Kim. And she likes the idea of having maybe gloves in the bathroom. I don't know if she has a little bit of OCD going on, but
Or maybe
I thought that was a good one.
She might actually want to share that story with us. But how about you, Joanne? What do you think? Because this was actually a thought that you had talked about this with me.
Yeah, I think about a year ago I had left work and I was a little frazzled from the day. I posted to Facebook for my friends who are friends with me to answer what they were looking for in a primary care provider, because I think at that particular day I was feeling more of like a pizza delivery person, right? I went into an appointment and I don't think that the patient really got what they were coming in for. And they were looking for, I believe it was an antibiotic at the time.
Okay.
And I didn't think they needed an antibiotic. And
so you tried the whole education piece.
And when they left, I just really wanted to know, was that person satisfied with their care, satisfied with what I was able to give them, or was it they came in for the antibiotic, they didn't get the antibiotic, so were they upset about that?
Okay, yeah, and that's absolutely the truth. We spend a lot of time in these rooms trying to educate you because we don't want you to take medications if you don't really need them. And it does. We take a lot of time doing all of that education, and it's time and time and time again. And typically it is the antibiotic. Yep. But now with the World Wide Web, you guys are able to research a lot of things. And when you come in, you think that you have the answer. It's our job to make sure that we're listening to you and we try to give you the recommendations that we know or that we think might be best for you. So don't always feel like you're dissatisfied if you came in with an expectation and you're leaving without what you thought you should be getting.
Voice that. Voice your concerns, and we can go over things. We set aside plenty of time that we should be able to go through what your expectations are and if we're not getting those expectations met.
Exactly. And that's any office that you go to, please talk to your healthcare provider about it. We much rather have you tell us if there's anything that you're dissatisfied with so that we can at least talk about it. right?
Yep,
I agree.
absolutely.
I
Yeah.
definitely agree.
I thought that was, like I had said at the beginning of the week, Joanne, when you first said it, I'm like, oh, really? Really? And as usual, when I sit back after I try to digest what you've said, you were absolutely right that day. You know what I mean? That's a big problem for people. So, not so much just talking about Landmark, we're talking about any healthcare practice that you go to, all right? It's really important that you have real good communication skills. We want you to feel like you should be comfortable and you should be relaxed, that you can tell us anything and that we can talk about anything, that you're not being judged.
Right.
Because if you're being judged, then that's not going to work out. That's not a real good relationship. And then also, what else was I going to say? I'm telling you, these whining things set me
I
off
know,
all the
they
time,
do.
don't they?
I wanna
I
say
want
hi
to
to
say hi
everybody.
to, I know, me too.
Hello, everybody.
Hi, Mom. I love you.
I saw that, yeah.
But yeah, anyway, so just, make sure that you have open communication. And not only, I don't want you to feel like you're just a friend. I do want you to feel like it's a friendly environment, but I want you to know that you have professionals who are caring for you and that we're doing the best that we possibly can. Let us know if there's anything more that we can do. But I also want you to leave here feeling like you had professional services and that we did our job and we weren't just talking about, the weather and what's going on in your life. Although that's all important, I also want you to know that we're looking over all your body parts and the things that we need to be doing and documenting it because that's all part of the whole process,
Right.
right?
I agree.
Yep, absolutely.
Anybody you want to add anything?
We're missing Chrissy today. She's off because of Memorial Day weekend. So,
Yes.
Chrissy, I hope you enjoy your camping trip.
Yeah, we miss you.
It's not the same without you on live.
The other thing is you all know how I love stories, and Joanne wanted to share one this morning with you. So I'm going to turn it over to Joanne.
And I apologize for those of you who are friends with me on Facebook. I did post this the other day, but I love the story, so here it is. There is a story they tell of two dogs, both at separate times walk into the same room. One comes out wagging his tail, while the other comes out growling. A woman watching this goes into the room to see what could possibly make one dog so happy and the other so mad. To her surprise, she finds a room filled with mirrors. The happy dog found 1,000 happy dogs looking back at him, while the angry dog saw only angry dogs growling back at him. What you see in the world around you is a reflection of who you are.
Awesome, Joanne. I
No
love
idea who that's from, but great story.
So no disclaimer
No
there.
disclaimer.
Well, listen, guys, we're going to sign off. We hope you have a happy, safe holiday weekend.
Yes.
And don't forget what the weekend is all about and take pause for maybe a couple of minutes and really reflect on what this weekend is all about.
We'll be back on Tuesday with Susie and Joan.
Excellent.
5 o'clock.
Have a
Bye,
great one,
guys.
everyone.
Bye, guys.